Did you know that nearly 1 in 3 adults over 60 may already have prediabetes and not even realize it? That means millions of seniors are quietly heading toward type 2 diabetes without warning until it's too late. But here's the good news. Prediabetes can be reversed, and today we're going to show you how. From unusual symptoms that most people ignore to small daily habits that make a big difference. This video could change the course of your health. So, if you're over 50 or care about someone who is, stay with us. Prediabetes isn't just a warning sign. It's your body shouting for help. When your blood sugar starts creeping up, but hasn't yet reached full-blown diabetes, you're already at increased risk of heart disease, kidney problems, and nerve damage. And because symptoms are often mild or absent, many seniors only discover it after complications arise. The tricky part? You may feel perfectly fine, no thirst, no weight gain, no fatigue. But inside, insulin resistance is building, cells are starving for glucose, and inflammation is on the rise. The good news is this condition is highly reversible, especially in the early stages. The key is recognizing the red flags and making lifestyle changes before it's too late. In the next few minutes, we'll explore the 7 most overlooked warning signs of prediabetes in older adults and what you can do about them, naturally, safely, and effectively. Let's dive into the 7 early warning signs of prediabetes that older adults often overlook. These signs may seem harmless at first, but they could be your body's way of waving a red flag. 1. Increased thirst. Do you feel unusually thirsty even after drinking water? This is a classic sign that your blood sugar is elevated. Your body is trying to flush excess glucose out through urine, making you lose fluids rapidly. 2. Frequent urination. If you find yourself waking up multiple times at night to urinate, don't chalk it up to aging or prostate issues just yet. It could be your kidneys working overtime to remove excess sugar. 3. Fatigue. Feeling tired after a full night's sleep? Your body may not be efficiently using glucose for energy. This sluggishness is often one of the first signs people ignore. 4. Blurred vision. High blood sugar can cause the lenses in your eyes to swell, leading to temporary vision problems. Many seniors attribute this to aging or cataracts, but it could be prediabetes. 5. Slow healing cuts and bruises. Have you noticed that small cuts or bruises take forever to heal? Elevated blood sugar can impair circulation and immune function, slowing your healing response. 6. Tingling or numbness in hands or feet. This could be an early sign of nerve damage caused by rising blood sugar levels. It's subtle but serious and very common in older adults. 7. Unexpected weight gain or loss. A sudden change in weight, especially around the belly, could mean your metabolism is being thrown off by insulin resistance. None of these symptoms alone confirm prediabetes, but together they form a pattern that shouldn't be ignored. And here's something important. Many people have no symptoms at all. That's why the next part is crucial. Understanding why older adults are particularly vulnerable to this silent condition. As we age, our bodies undergo several changes that increase the risk of prediabetes, even in people who have never had blood sugar problems before. Let's take a closer look at why seniors are more vulnerable. First, muscle mass naturally decreases with age, and that's a problem because muscles help your body use glucose efficiently. Less muscle means more sugar stays in the bloodstream. Second, many older adults become less physically active due to joint pain, mobility issues, or just a slower lifestyle. Lack of movement contributes to insulin resistance and weight gain, especially around the abdomen. Third, aging often brings changes in diet. Some seniors consume more processed or convenient foods, high in sugar and low in fiber, simply because they're easier to prepare or chew. Fourth, hormonal shifts play a role. As we age, the body's ability to produce and respond to insulin declines, even without other health issues. Add in stress, sleep disruptions, and certain medications, and you've got a recipe for rising glucose. Fifth, chronic inflammation becomes more common with age. This low-grade, long-term inflammation interferes with insulin signaling, pushing blood sugar higher over time. Finally, many seniors take multiple medications. Some of these, like steroids, blood pressure drugs, or even antidepressants, can raise blood sugar levels as a side effect. All these factors combine to make prediabetes far more likely after 60, even if your weight is stable or your diet hasn't changed. That's why it's so important to know your numbers and track them regularly. Let's talk about which tests matter most and how to interpret the results. So, how do you know if you're in the danger zone? The only way to be sure is through testing. Let's break down the 3 most important tests doctors use to detect prediabetes and what your numbers should look like. 1. Fasting blood sugar, FBS. This measures your blood sugar after 8 hours of no eating. A normal reading is under 100 milligrams per deciliter. Prediabetes is between 100 and 125 milligrams per deciliter. Anything above 126 on 2 separate tests is considered diabetes. 2. Hemoglobin A1C, HbA1c. This gives a snapshot of your average blood sugar over the past 2 to 3 months. It's a powerful tool because it's not affected by what you ate yesterday. A normal A1C is below 5.7%. Prediabetes falls between 5.7% and 6.4%. Over 6.5% is diabetes. 3. Oral glucose tolerance test, OGTT. This one is less common but very accurate. After fasting, you drink a sugary liquid and your blood sugar is measured 2 hours later. A normal result is under 140 milligrams per deciliter. Prediabetes is 140 to 199, and anything over 200 is diabetes. Many seniors skip these tests because they feel fine. But prediabetes doesn't always cause symptoms until it does real damage. Getting tested at least once a year, especially if you're over 60, could help you prevent a lifetime of complications. Let's take a closer look at one of the earliest and most overlooked warning signs of prediabetes: unusual fatigue. Many older adults assume that feeling tired is just part of aging. But when you start needing a nap in the middle of the day, or find yourself struggling to complete simple tasks that used to be easy, it could actually be a sign your blood sugar is out of balance. Here's what's happening inside the body. When your cells become resistant to insulin, they don't absorb glucose as efficiently. That means the fuel your body needs isn't getting delivered where it's supposed to. The result? You feel exhausted, even after a full night's sleep or a day of rest. It's a sluggishness that doesn't go away, and it's often your body's first cry for help. Another early clue? Increased thirst and more frequent urination. These symptoms are directly related. As excess sugar builds up in your bloodstream, your kidneys work overtime to filter it out. This pulls more fluids from your tissues, making you dehydrated, and in turn, triggers that constant, unquenchable thirst. If you're waking up several times at night just to use the bathroom, it's not just inconvenient, it could be your body trying to flush out excess glucose. Pay attention to blurred vision. This isn't just a matter of needing new reading glasses. When blood sugar fluctuates, It can cause the lenses in your eyes to swell, temporarily altering your vision. Some people describe it as foggy, others like a film over their eyes. If your eyesight changes suddenly or seems to shift day to day, don't brush it off. It could be one of the earliest signs of glucose imbalance. Lastly, in this group of symptoms, slow healing. Have you noticed cuts or bruises taking longer to fade? High blood sugar can weaken the immune response and damage small blood vessels, especially in the legs and feet. This means minor wounds or skin irritations can linger longer, increasing your risk for infections and complications. If you're still treating a small cut weeks later, it's time to pay closer attention. These early symptoms can sneak in quietly. They're subtle, and that's what makes them so dangerous. Because they often don't feel serious, many older adults ignore them until prediabetes becomes full-blown diabetes. The good news is, recognizing these signs early gives you a powerful head start in managing your health. Now let's go deeper into the less obvious, but equally important warning signs of prediabetes in older adults. Those that are often dismissed, misdiagnosed, or simply misunderstood. One that surprises many people is tingling or numbness in the hands and feet. You might notice a slight pins and needles sensation after sitting too long, or your hands might feel numb when you wake up. These symptoms can be caused by nerve damage, even in the early stages of elevated blood sugar. It's called peripheral neuropathy, and it doesn't wait for full-blown diabetes to start. High glucose levels can begin damaging nerves gradually, especially in your extremities, long before a formal diagnosis is made. If this is happening more frequently or paired with burning, sharp pain, or loss of balance, it's time to speak to a doctor. Next, let's talk about something more emotional but equally real: mood changes. Chronic irritability, anxiety, or even unexplained sadness may be linked to poor blood sugar control. Why? Because glucose is your brain's primary energy source. When it swings too high or too low, your brain chemistry can shift, leading to changes in mood, memory, and decision-making. Seniors might blame it on aging or even early dementia, but in many cases, it's your blood sugar calling out for balance. If you find yourself more short-tempered than usual or feeling low without a clear reason, don't ignore it. Another sneaky sign? Unexplained weight changes, particularly sudden weight loss. Now, you might think losing a few pounds without trying is a good thing. But if you're eating normally and still dropping weight, your body might be struggling to absorb and use glucose effectively. Instead of using sugar for fuel, your body may begin breaking down fat and muscle. This can lead to dangerous muscle loss, weakness, and frailty, especially in older adults. If you're shedding pounds unintentionally, it's worth looking into your metabolic health. Let's also talk about frequent infections, particularly urinary tract infections, UTIs, or yeast infections. High blood sugar provides an ideal breeding ground for bacteria and yeast, especially in warm, moist areas of the body. Older women, in particular, may experience recurring UTIs or vaginal infections that don't fully resolve. Men might deal with skin infections or slow-to-heal sores. If infections become more common or seem resistant to treatment, that could be your body struggling with sugar control. Another overlooked red flag? Darkened patches of skin, especially on the neck, armpits, or groin. This condition is known as acanthosis nigricans, and it often looks like velvety, brown, or grayish areas that appear almost like dirt. While it's not harmful on its own, it's a visual cue that your body may be developing insulin resistance. Many people scrub at these patches thinking it's a hygiene issue, when in reality, it's a warning sign from within. Don't forget about constant hunger, even after eating. If you finish a full meal but still feel the urge to snack, or if you're waking up hungry in the middle of the night, it might be due to insulin dysfunction. When insulin doesn't work properly, your cells are starved for energy, and they send hunger signals to your brain, leading to more eating, more sugar, and a vicious cycle that fuels prediabetes. Lastly, there's trouble sleeping. Poor blood sugar regulation can disrupt your body's natural rhythms. You might have difficulty falling asleep, staying asleep, or you might wake up feeling unrest. In some cases, nocturia, waking to urinate multiple times at night, can fragment sleep. In others, sleep apnea may be involved, which is common in people with insulin resistance. And here's the kicker. Poor sleep raises your blood sugar levels even more. It's a self-perpetuating loop. What makes all these signs so dangerous is their subtlety. They don't always shout, they whisper. And if you don't know what to listen for, they're easy to miss. But each symptom, when viewed in isolation, might not raise red flags. It's when you connect the dots, when you recognize that your body is speaking a language of warning, that you gain the power to act. And here's the truth. You absolutely can take action. Prediabetes is reversible. Your body is incredibly adaptive, especially when you catch the warning signs early. Lifestyle changes, natural remedies, and smart habits can restore balance before lasting damage is done. So now that you understand the signs, what's next? In the following sections, we'll guide you step by step through the most effective and natural ways to manage blood sugar, reclaim your energy, and protect your future. Because no matter your age, your health story is still being written, and you hold the pen. So, how do you respond when your body starts whispering these warnings? It begins with awareness, but it must move quickly to action. And the first and most powerful step is something completely in your control: your plate. Eating to reverse prediabetes doesn't mean going hungry or giving up everything you love. It means choosing foods that help stabilize your blood sugar rather than spike it. Think whole, fiber-rich carbohydrates like oats, lentils, sweet potatoes, and leafy greens, all of which slow sugar absorption and support insulin sensitivity. Protein is equally essential, especially for older adults. Include high-quality sources like eggs, salmon, chicken, tofu, or Greek yogurt in every meal to help curb sugar cravings and support lean muscle. And don't fear healthy fats. Avocados, olive oil, nuts, and seeds help slow digestion and reduce post-meal glucose spikes. When combined with fiber and protein, these fats turn your meals into blood sugar-friendly powerhouses. But it's not just what you eat, it's also when you eat. Skipping breakfast or eating large meals late at night can disrupt your metabolism. Instead, aim for consistent meal timing with balanced portions throughout the day. This gives your body a rhythm and helps prevent sugar crashes or surges. And hydration? It matters more than you think. Even mild dehydration can increase blood sugar levels. Make sure you're drinking enough water, herbal teas, or adding a splash of lemon to keep things interesting and refreshing. Now that we've talked food, let's move to the second pillar of prevention and reversal: physical activity. You don't need to run marathons or lift heavy weights to lower blood sugar. In fact, gentle, consistent movement is often more effective, especially for older adults. A brisk 20 to 30-minute walk after meals can dramatically reduce post-meal glucose spikes. Why? Because your muscles use glucose for energy, pulling sugar from your bloodstream without the need for extra insulin. Even basic strength exercises like chair squats, resistance band pulls, or light dumbbell curls help build muscle mass, which is a natural sugar-burning engine. And the more muscle you maintain as you age, the better your body handles glucose. But exercise doesn't stop at formal workouts. Gardening, dancing, vacuuming the house, walking the dog, all of these count as movement. The goal is to reduce long stretches of sitting. Even standing up and stretching every 30 minutes can improve insulin sensitivity. Next, we can't ignore the role of stress. Chronic stress triggers the release of cortisol, which tells your liver to dump extra sugar into your bloodstream, just in case you need to fight or flee. But in modern life, that sugar surge often has nowhere to go, especially if you're sedentary. That's why relaxation techniques are just as important as food and exercise. Try deep breathing exercises, gentle yoga, meditation, or prayer. Even spending time in nature or laughing with friends reduces cortisol and helps stabilize blood sugar. And don't underestimate the power of sleep. Poor sleep throws your hormones out of balance, increases cravings for carbs and sugar, and leads to higher fasting glucose. Aim for 7 to 8 hours of high-quality sleep, ideally going to bed and waking up at the same time every day. Create a dark, cool, quiet sleep space, and turn off screens at least an hour before bed. Each of these small, natural habits adds up to big results. Let's now talk about monitoring, because knowledge is power, especially when it comes to prediabetes. If you're over 60, regular blood sugar checks are one of the smartest things you can do. You don't need to wait for your yearly physical. Many pharmacies offer free screenings, or you can use a home glucose monitor to track your fasting blood sugar and post-meal responses. Ideally, fasting blood sugar should stay below 100 milligrams per deciliter, and post-meal numbers should be under 140 milligrams per deciliter 2 hours after eating. But don't stop there. Keep an eye on your waist size. Abdominal fat is strongly linked to insulin resistance. And track your energy levels, mood swings, and cravings. These are subtle signs that your blood sugar may be out of balance even before labs reveal a problem. The earlier you notice a trend, the easier it is to correct it. Don't wait for a diagnosis. Take action when the signs are still whispers, not screams. That's how you stay in control. Another overlooked key to preventing prediabetes from progressing is gut health. That's right, your digestive system plays a major role in how your body handles sugar. Your gut is home to trillions of bacteria, known as the gut microbiome. When the good bacteria thrive, they help regulate inflammation, support metabolism, and improve insulin sensitivity. But when unhealthy bacteria take over, often due to poor diet, medications, or stress, it can trigger chronic inflammation and worsen blood sugar control. To support your gut, eat more fiber-rich foods like oats, beans, chia seeds, and vegetables. These feed beneficial bacteria and help slow down sugar absorption. You can also include fermented foods like yogurt with live cultures, kefir, sauerkraut, or kimchi. They introduce healthy microbes that rebalance your gut. Avoid overusing antibiotics and limit ultra-processed foods. They harm your gut flora. A healthy gut doesn't just help digestion. It can literally help reverse insulin resistance and protect your brain and heart at the same time. Taking care of your gut is like building your blood sugar defense from the inside out. So what's the big takeaway? Prediabetes in older adults is not a life sentence. It's a powerful warning and an opportunity. If you've noticed symptoms like constant thirst, fatigue after meals, stubborn belly fat, or blurry vision, don't ignore them. These are your body's signals asking for change. And the good news? You don't need extreme diets or medications to make a difference. Small, sustainable steps, like eating whole foods, walking daily, getting better sleep, managing stress, and watching your numbers, can dramatically improve your health. Talk to your doctor. Get tested. Make a plan. Share this video with a friend who needs to hear it. Because with the right information and action, you can stop prediabetes in its tracks. Your future self will thank you for what you start today. And remember, when it comes to your health, you have more control than you think. Thanks for watching. Stay informed, stay active, and stay well.